Hello everyone, welcome back, and today I'm gonna show you a root canal obturation setup. Okay, it's an obturation, it's an RCT, and it's obturation. Okay, so let's start with the tray. So this, you have to prepare the tray that you put on the dentist side. So we have the handpiece here, we have topical gel here, because obviously the dentist has to numb the tooth. And your hand instruments are, you have your tweezer or cotton plier, and we have an spoon excavator here. This is to help in cleaning the pulp chamber when the dentist will be doing an obturation. So this is a spoon excavator, and this is his probe. Okay, probe, and this is a flat plastic, this one here, and this is the DG16. So a DG16 looks like this. Okay, double end. This is to reach the canal, and obviously you have your mouth mirror. Okay, so that's it. And then we have the setup syringe here already. So I set up the you have the short needle. We are using a short needle today, and obviously the anesthetic. When a patient is very nervous, don't put your syringe in your tray. So when the patient will come, they will not see the syringe, and sometimes they get more nervous or anxious or scared. Okay, so just leave them on the side. Just pass it to your dentist when he does the numbing of with the topical gel, and then you pass the dental syringe. And here we have the files. We have the rotary files. Yeah, we use a rotary file for this patient, and we have scissors here, to cut anything. And this is a syringe with sodium hypochlorite, and this is the endodontic ruler, and this is the root canal sealer. Because we're doing obturation today, we need to prepare the root canal sealer, and this is the mixing pad to mix these two, and this is the spatula to mix again, because this is two kinds. Okay, so you need to squeeze this one here, and then squeeze that one here, the sealers, and then you mix them with this spatula. All right, so this is my sodium hypochlorite inside, and also I have my EDTA here, so you need to prepare your EDTA. And here we have some, it's called verifiers. This is to check if the dentist they will check the canal. If there's more space in the canal, then they have to put more GP or obturator. Okay, and this is where we will soak the thermafil or the GP later on. This is a sodium hypochlorite, and here we have the thermafil. If you can see, it has different sizes. Okay, this is what my dentist will use today to fill up the root canal. Okay, so it comes in different sizes, different colors. I have more of here, but I'm just showing you how they look like, and they look like this. And sometimes we need a blade, scalpel. Sometimes they need to reduce the thermafil, so we need a scalpel. All right, and this one here, this is a obturator. It's an oven. This is where they will soften the thermafil. So if they have the right size, they will just pop this in here, obturator, in the oven, I should say. Pop the thermafil here. This has to go down there. put it in there, and then just press this down and it will just warm the thermafil. Okay, so that's how a thermafil obturator looks like. And then we have the ruler, endodontic ruler, to measure the thermafil. Okay, and you have your then we have our rubber dam up here, which this one is the rubber dam sheet. This is the clamp holder, this one here, and this is the clamp, and this is the rubber dam frame to hold the rubber dam sheet, and this is the rubber dam puncher. And then this is a flowable composite. We use this to block the hole from the clamp. So when they put the clamp, they will block it with flowable composite around it, so to make sure that there's no hypochlorite. It won't drip inside the patient's mouth, so they have to block with composite around the clamp. And we have here a it's called a glide to put in the canal to like make the filing a bit easier, so they need to use a glide. And this is an endo activator. Okay, so your clinician will put this tip, they will put sodium hypochlorite inside the canal, and then they will use this activator to clean the canal. So, like this. Okay, there you go. And then we have a X-ray. Because we're doing a molar today, you need to prepare a posterior holder. This is a periapical holder, and you need to set up the film as well. So then when they finish obturating, cleaning all the pulp chamber, they will fill it up. So we have to use a glass ionomer, this one here, to fill up the pulp chamber, and this is used to hold the mixed glass ionomer when you fix it later on. And now we come to the apex locator. This is the apex locator. Apex locator, they come in different appearance, different styles. It depends on your surgery. So with us, we have this one here. This is an apex locator to check the length of the canal. And these are the accessories for the apex locator. Okay, so you need to attach them there. These are removable. You can sterilize them when you're finished. And then the next one, we have the rotary. We have the endodontic rotary. It's this one here. Again, it all depends on your surgery, which one is available. For us here is this one here. So this is the handpiece, and this is where your file goes later on, the one I've shown you earlier, which is this one here. The rotary file will go in this handpiece. Okay, and obviously you have to have a patient's eye protector and the bib. Okay, and you already have set up your aspirator in your chair, so then everything is ready. So there you go. I'll just run again and you can have a look. And by the way, we have a paper point here, so I forgot to tell you. These are paper points with different sizes. Okay, it all depends on the size of the canal, so your clinician will choose which size of paper points they will use. And obviously you need a tweezer to hold the paper points and to pass it to your clinician or to your dentist. Okay, so there you go. And your tray setup, you need to put it on your on the tray on your dental chair. All right. So this is the setup for root canal treatment obturation procedure. It all depends on which surgery, on your surgery, which one are available. Okay, so uh, setup is different, but you can learn probably from like basic ones. All right then. Thank you very much. And if this helped, please click that like button. Thank you. Bye.